there's, I guess from my view, often some underlying trauma or traumas, and frequently those are developmental. And when I say that, that doesn't just mean sort of like what people would call big T traumas, like I had, some severe incident that happened in childhood or in adulthood. But there's also all these little T traumas, which are about the absence of things that maybe should have happened that didn't.
Welcome to Intonicated, a podcast about psychedelics, learning, and well-being. Intonicated is an adjective that describes a heightened, expansive, and health-affirming state of consciousness marked by clarity, vitality, and integration, in which a person feels inwardly attuned and stretched towards deeper awareness, emotional resonance, or spiritual growth. I'm your host, Ken Tupper. Please be sure to like or subscribe. Okay, welcome to Intonicated, a podcast about psychedelics, learning, and well-being. And joining me today is my good friend and colleague, Cody Callon. Cody, hi. Do you want to start off by introducing yourself?
Yeah, thanks for having me, Ken. Really happy to have a chance to be here. So my name's Cody Callon, and I currently work as a therapist in private practice, as well as at a medicine clinic in Vancouver called the Center for Medicine-Assisted Therapy. By background, I have an undergraduate degree in psychology and a master's in social work. And my career has sort of spanned from initially working with street-involved people who use drugs, kind of addictions work, harm reduction work, into more addiction treatment sort of focus, and then from there into therapy and with a specialization in trauma work and psychedelic-assisted therapy in particular.
Great. Well, I look forward to talking more about that as we get going. Maybe you can start off also by telling us how you got interested in psychedelics, I guess both personally and professionally in the first place.
Yeah. It's something that to me feels a bit like it happened by accident or happenstance. It's not something that I set my goals on, but I started my career while I was in my undergraduate degree working in the downtown east side of Vancouver, first as a service provider with the Portland Hotel Society, now called PHS Community Services Society. And then I was also doing some research, which was then with the BC Center for Excellence in HIV and AIDS after that.
And did
And
you have any interest in psychedelics already at that point in terms of curiosity or?
No, I didn't. And I also didn't have much experience with drugs or really awareness of that world either. What initially happened is I was doing my undergraduate degree in psychology and I applied to a bunch of different nonprofit organizations to try to get work in the summer after my third year and ended up getting a job with PHS. And it was then through working in that community and meeting people and really started to kind of develop a curiosity about different classes of drugs and their
And
effects.
just
And
for folks who don't know, PHS or Portland Hotel Society operates in the downtown east side of Vancouver, which is sort of known as a hotspot for drug use and addictions for many decades now.
yeah, exactly. And they provide a bunch of different services. They ran hotels and provided low-income housing for folks. I worked at a low barrier drop-in center that provided sort of meal programs, laundry, other education and activism groups, and things like that. And then they were actually the folks that first staffed Insight, the supervised injection facility in Vancouver that was touted as the first in North America, although the Dr. Peter Center had some nurses that were running a site before they opened. So yeah, they were doing a range of different things in that neighborhood. And so through that, I got to know, both the community of people that lived down there as well as folks that were working down there. And that really, yeah, got me interested in a range of different substances. And to your question, I then was at a social gathering, a party with some coworkers, and there was a gentleman who started talking to me there about ayahuasca. And I hadn't even heard about ayahuasca up until that point, working in that neighborhood. It wasn't something that was being used by folks down there, at least that I was speaking to. And he spoke about having some tremendous and beneficial experiences for himself in terms of healing and personal growth, attending ayahuasca ceremonies. And so I was really, yeah, kind of got curious. It felt in that conversation a bit like a sales pitch. Like by the end, I was kind of like, okay, sign me up. Where do I go to one of these
And
ceremonies?
did he connect
And
you?
he did not. The thing that he said to me at that time, which was, uh, feels appropriate in retrospect, but was, when the time is right, it'll find you. But at the time, I was quite deflated by that and felt like it was kind of ridiculous that he'd spent so long speaking about, the positives of this, and felt like kind of convinced that this was a thing that I should do. And yeah, to leave it off
What
as that was.
what were
Mhm.
your perceptions about psychedelics? Like you must have heard of LSD and magic mushrooms prior to that.
Yeah, yeah, of course. I mean, I think that my previous perception, I grew up as an athlete. I was very focused on just like trying to be healthy in sports. I was a competitive track and field and cross country runner. So prior to my work in that neighborhood, I was really like, I don't want to put anything in my body that could be potentially harmful or dangerous. And, had some ideas from the leftovers of the war on drugs and kind of Reagan era advertisements of what that could mean
So you
for
were pretty
me.
straight edge.
And yeah, so I was pretty straight edge going into that scenario in the first place. And so, I think originally psychedelics seemed like something that, uh, I don't know, to be honest. Like it was, maybe people that were wanting to explore different things that I was not yet sort of privy to or even really curious about based on, I guess, the peer groups that I had prior to
So
that.
this conversation sort of piqued your curiosity, and then
It piqued my curiosity, yeah. And then it was several years past that I went through grad school. I did my master's in social work at UBC. I had somewhere in there seen a Nature of Things episode where Gabor Mate was taking people from the downtown east side to Bowen Island to do ayahuasca retreats as a way to try to help them with their addiction. And I was very curious about that episode after I'd seen that or had this conversation previously. And also, I knew Gabor when I was first working at PHS. He was the house doctor for Portland Hotel Society or PHS. So I had a, distant relationship with him, but I knew him and of him. And so I was very curious about that. And then I did a bunch of community organizing work with the Vancouver area network of drug users through my master's degree. I'd had some funding from the Canadian Institutes of Health Research to do a community-based research project. And that was ultimately, I think, like very rewarding in terms of the work that I was doing and my passion about it. It was some of the earlier work that was bringing peers into education and support initiatives related to healthcare interventions and harm reduction interventions, and even just like healthcare interface between our system and marginalized people who use drugs. And it was a lot of work to be working alongside and supporting those individuals, along with the organizing and the research I was doing, and just the rigors of grad school, trying to work part time in addition to that. I was pretty burnt out by the time I finished grad school and wasn't in a great place in myself.
yeah, I can imagine.
And an invitation yeah, and an invitation came around that was a connection to the ayahuasca ceremony leader or curandero that Gabor had been working with. And I took that invitation with some intrigue and excitement at that point for what that might hold for me. And I went to one of those ceremonies and had a really beautiful first ceremony and introduction to what that was and sort of has continued to be. I've participated in ayahuasca ceremonies and retreats and master plant dietas. The first time I went was in 2012, up until the last few years. So it's been something that's, persisted for me. And
So, what did you make of that
yeah,
first introduction?
I mean, I think something that gets talked about in that world, as you know, is plant spirits, and an idea that within different plants, and including, I guess, like ayahuasca being Banisteriopsis caapi and chacruna combination, that there is a plant spirit there. That was completely outside of my worldview or way of understanding or knowing. And yet I experienced meeting what seemed like a wise, knowing, motherly, grandmotherly sort of presence that seemed to know me in ways better than I did. And it was as though we went on just a beautiful long walk together that night, getting to know each other and kind of sharing things about me and also some potential for the future, which was, yeah, just it felt like otherworldly, and yet at the same time, was something that I was undeniably myself experiencing at that time. Something that I have been curious about is, there had been already language that I'd heard that, like mother or grandmother ayahuasca. I wonder if I would have put that sort of gender to it had I not had that already, introduced somewhere,
Yeah.
but undeniably there was something other than me that I felt was there and knew
How
me.
much does the broader public discourse that we're exposed to shape our experiences when we finally have the opportunity to encounter these? It's yeah, perennial question for sure.
Yeah,
So did that also
yeah,
spark your professional interest then? Did you see the therapeutic potential that you then thought you could pursue in your social work or psychotherapy
yeah,
work?
yeah. It's a great question. It didn't exactly flow that way. I think, something that has been present in my career is more so than being goal oriented or goal driven in terms of like, this is what I want to move towards. It seems to me that different doors that have been interesting have opened. And at some point, I have a choice whether to walk through one of those doors or not. This initially sparked certainly personal interest in me, and also, like academic interest, like the part of me that wanted to understand this experience that seemed, like really outside of my worldview, was very alive. And I actually got, in retrospect, I think, was some very good advice from one of the helpers that I met there. And he cautioned me not to go into kind of like reading too much or trying to study too much about this before I maybe had some more experiences. And I think he probably intuited or saw in me, maybe a strong intellectual part or mental part that wanted to like figure it out and understand, and could then subsequently be maybe overly influenced by other people's perceptions and experiences. And I think that was really sage advice that I ended up taking.
I would say
So
so,
it was initially,
given that I didn't have
yeah,
that advice myself and certainly did the deep dive into the literature long before I had, and then even after I had experiences. I mean, we all follow our own
right.
paths, but that's amusing.
Uh, yeah,
So,
yeah.
so
Well,
you did
something
more ceremonies after that?
I did more ceremonies. It was a year before I went back again. And part of that was timing, but a part of it was also cost for me at that time. It was relatively expensive for what my means were to do something like that. And so that was also a limiting factor. And a year later, I went back. And that was then a 3-day retreat, or 3 ceremonies over the course of a weekend. And at that point, again, I felt like I picked right up where I left off in terms of the ceremony and that relationship with the plant. And got the message like, that, there's something really here for you. Like, I want you to come back and kind of come back as soon as you can. And so in that next year or two, I traveled back and forth from here to Mexico and engaged in a few different retreats and really started to, yeah, gain some ground in terms of both like healing, spiritual growth, personal development and growth and betterment. And I struggled with kind of like making the most out of those experiences in my life when I was back at home. Part of the challenge there being that I didn't have a community of people or even friends that I knew that were doing this. And so
So
I feel like I was having these, yeah,
integration was a challenge.
yeah, that's the word that I would give to it
Yeah,
now. I
right.
didn't have that understanding even at that time, 2013. I'm sure that language might have been around in the field, but it wasn't in my
Mm.
sphere. And I was struggling to integrate without, really sort of like someone to be mentoring me in that or a supportive community. And so, yeah, I was floundering a little bit, I would say, in terms of making the most out of it. And then I started to see the opportunity that wasn't that then yet professional, but the folks that were holding the ceremony, they would have these sharing circles. And I would say that they were variously done at that time in terms of like how well that they were held and facilitated. Part of that was that that wasn't the area of expertise of the people that were holding the ceremonies, as well as they were tired. They've been up working all night. But that's my perception,
Hmm.
anyways. And so I had expressed to one of the people that was organizing there that, like, oh, this really interests me. Like, I think that there's area here with, some of my background and experience and facilitating groups, community organizing, group work, that I could see this being done a lot better and people getting more out of it, myself included. So I kind of wanted that and shared that with this organizer. And I'm like, I think there's myself, but also other people here that have those skills. And what she said to me was kind of similar to the initial invitation I got from the guy at the party, which was like, that's a great intention. I encourage you to just sort of hold that as an intention and prayer, and, maybe that'll come to be in time. So certainly, there wasn't an invitation then to step into that. But within the next couple years, I learned about and got invited to a retreat that Gabor was helping to facilitate that was in Mexico. And they were doing these like 9 or 10 day long trauma focused retreats where the curanderos, who were Western folks but Shipibo
Hmm.
trained, having spent a lot of time in Peru under indigenous Shipibo teachers, were holding the ceremony, serving the medicine, doing the healing work in the ceremonies. And then Gabor was facilitating group process to prepare people and help kind of like deepen their insights and experiences and help them to integrate afterwards. And getting to go and see and experience that, I was like, this is more, what I want. This is what I was looking for. This is what I would like to be more involved in. And still at this point, I hadn't seen a professional path forward with it. Um, but it did seem like something I wanted to lend some of my skills to in this like personal community that I was getting involved in. And meanwhile, I was also now meeting more people that, lived in and around Vancouver that were also attending these ceremonies and kind of like developing some more sort of peer support, or what we might call it in some of the literature now, sort of like
Hmm.
communitas in terms of integration support and community setting. And so I applied to go back and assist with those retreats. And I got to do that over the course of about 3 years. I was traveling down to Mexico, and it was still just like, I'm doing this because I'm passionate about it initially, and I want to contribute to this thing that's I'm getting a lot from. And also, if I give, I think that I'll continue to learn too. And so now I'm seeing the potential, but I'm not seeing the real like professional opportunity outside of this potential of community and really like volunteer work that I'm doing
So
until,
I was going to
you
ask, what
know,
so what was the sort of tipping point into becoming
yeah,
sort of fully
un
professionalized?
until, uh one of the physician that I had worked with for many years, Dr. Evan Wood, who's public health physician, addiction specialist, done a lot of research. He approached me and asked if I'd be interested in helping him to get a study going that would be using psilocybin in a treatment of substance use disorders. And he was really interested in quite a practical, kind of real world version of what a clinical trial like that could look like. And he knew about this stuff that I was doing, in my personal life, and also that I had quite a bit of research experience at that point. So I think those are the reasons why he invited me. And I was actually looking to not do research anymore at that time, and was like, if I'm gonna lend those skills to anything, this is probably about as interesting as it gets. And that had me then shift into reading kind of like all the literature I could get my hands on in terms of peer-reviewed studies at that time, looking, first at psilocybin, then I was looking at the MDMA literature. And
And
at that point,
th-
we're probably 2017. It like wasn't that hard to find and read all the studies. That's a bigger task
yeah,
increasingly year to
there
year
was just a
here.
handful then. And that was around the time that you and I
Yeah.
first met.
And that was around the time that we first met. And I think you probably would not remember this, but sometime before that, you were doing a talk on ayahuasca at UBC, which I think might have been like following your PhD, but with some relation to some of your PhD research. And I, yeah, very keenly traveled myself out there on my bicycle. I didn't have a car at that point to watch your talk. And I was just thought it was, it was so cool that you or anyone had done a PhD related to ayahuasca, and was like really excited to see that talk. And I think I met you briefly there,
So you were
but
defying the
yeah.
advice of not delving too far into the literature on ayahuasca or
Well,
the academic
I
study.
was a little bit into it at that
Yeah.
point. And you know what I did after that? I downloaded and printed your dissertation. But I maybe for better or worse, I looked at it, but I never read the whole thing.
That's okay. There was a lot
Those
there
are
to read.
those are big
Exactly.
documents.
So okay,
But
so fast forward to you joined the BC Center on Substance Use that was starting
yeah.
up at that time.
And yeah, and then I think they both had like Evan was pretty excited about this opportunity and possibility. And an interesting link there is that his mother-in-law is Ingrid Pacey, who was a student of Stanislav Grof. She facilitated holotropic breath work for years, and Rick Doblin recruited her to be an early principal investigator on the MDMA-assisted therapy for PTSD phase 2 clinical trial to have a site in Vancouver.
Right.
And she was one of the therapists on that, as well as a PI initially on that study. So he had, I guess, like already this family connection. And he's always, I think, looking for innovative treatments for substance use disorders, and is a guy that tends to keep himself kind of on the cutting edge. And I would see this as part of that. But I think he recruited you as well as Mark Hayden to come work at the BCCSU. And I know your portfolio there covered much more of that as a director, but that part of it was, what you'd be able to contribute to us really trying to muscle through a study on psilocybin for substance use
Yeah,
disorders.
we built out some of the infrastructure, including getting therapists trained, and so I think we facilitated your going down to San Francisco to CIIS. Do you want to say a bit more about
Yeah,
that sort of formalized training for becoming a psychedelic psychotherapist?
yeah. So picking up from what this invitation was, and just like starting to read all I could in terms of literature, starting to read books, and trying to start to meet researchers. I think I'm so grateful because it was a huge opportunity for me that you had encouraged me to apply and go to the California Institutes of Integral Studies, and their psychedelic assisted therapy and research postgraduate certificate program, which I did in 2019. At that point in time, that was the only accredited institution or university that was offering any kind of certification or program in psychedelic assisted therapy and research. And there are some others now. And I think, I don't want to be like solidly quoted on that, but I believe we were the fifth cohort in 2019, the fourth or fifth cohort. And that was a mixture of in person as well as some online learning, quite a lot of reading, and involved also, ongoing small group work and mentorship. We got one-on-one mentorship when I was in that program. And Karen Cooper was assigned as my mentor, which I was very excited about. She was one of the researchers and therapists at the University of Wisconsin early psychopharmacokinetic study on psilocybin, and she'd written a therapy manual on psilocybin-assisted therapy. And then she also went on to work for MAPS in their MDMA for PTSD research. So it was a great opportunity to connect with her. A lot of the different faculty there I got to meet and kind of network with, and it was a chance, not only to like dig into the learning there, but it was really valuable networking that then I was able to have, phone calls with people like Anthony Bossis to, ask them about what they're doing at NYU and how that might inform what we wanted to do at the BCCSU.
But ultimately,
And
we weren't able to sort of land the funding and stand up the study. But then you were able to proceed with doing some active psychedelic psychotherapy work subsequent to your training. Do you want to say a bit more about the practical experience you got?
the practical experience, yeah. As you said, we were trying to do that, I think, really at an interesting time point where there was a burgeoning bubble around interest in psychedelic therapies. And up until that point, research was being funded predominantly philanthropically, which, MAPS was really leading the way with, or else, universities might be getting funding other ways, but, NIH, CIHR, those larger traditional funding bodies for government research grants weren't funding psychedelic
Mm-hmm.
research. And we started to see a shift in this time, I think sort of, maybe around 2019, 2020 into 2021, where there was a bunch of venture capital and companies starting up that were now taking investment dollars with promises around what they might be able to do in terms of therapy, research, training, etc. And so we really struggled at the BCCSU to get the money that we needed in order to have this study go. I think we had it together in terms of, the manuals that we needed, the protocol, the team in place. But it's expensive to run a clinical trial as well as a clinical trial that involves a lot of therapy hours by a co-therapy team. So that was a challenge. And Evan Wood got recruited by one of these companies, Numinous, to be their chief medical officer. And with that, had talked to them about funding this psilocybin substance use disorder study that we basically developed at that point. And so they, recruited me over there in order to, with the promise of being able to see that study through, which was the main motivation for me at that time. I'd always worked in the public sphere prior to that. And unfortunately, that study ended up getting shelved, as well as a handful of other studies that I worked on the development of there. But as funding priorities changed, my perception is that it was seen that, research costs a lot of money and doesn't necessarily have a clear return on investment, aside from contributing maybe to the broader field and advocacy and some of those benefits. But in terms of, bottom line dollars, it doesn't come back.
Yeah, it was really
So,
a
but
sort of pure research study, and there was obviously a lot of ambition in that early phase of the
mhm.
boom, the venture capital inputs, but not necessarily, yeah, a return on
Yeah.
investment that would satisfy the folks who are putting up the money. So it didn't actually take
Yeah.
off there either.
It didn't end up taking off there either. And again, I think it ended up being a money consideration. I think there's two things that, from my view so far, end up challenging moving forward with these kind of trials. One is the cost of them, and two is that it's a lot of work to put together a good clinical trial with the rigor that's required and being prepared for, what Health Canada needs, and likely having them make a site visit to a study like this. And so just all the rigor that's required, I think sometimes folks see it as an opportunity for access and don't really have an understanding of, what the cost is and how much work there is there. And once it starts going, at some point they end up shaking their heads and saying, this isn't worth it, for what my goals were. Whereas, like you said, I think our goals were more kind of pure science, and also to contribute something at that point. The psilocybin therapy work for addictions was focused on alcohol and smoking cessation, and we really wanted to, broaden that out to stimulant use disorders and opiate use disorders, as well as people who are polysubstance users, across alcohol, opiates, and stimulants, because that's more often what we
Mm-hmm.
see in addiction clinical settings. So I'm still very excited and passionate about that study and what we developed, and it's definitely a grief of me that it never happened. But yeah, back
Well,
to your question about
you were able to
the experience.
still proceed with offering or being involved in delivering therapy for
Yeah,
folks.
yeah. So, and in a few different ways, we did have a clinic in Vancouver for Numinous, and we started offering ketamine-assisted therapy there. So for about 3 years, I was involved in offering ketamine-assisted therapy in that clinic. We were also able to offer psilocybin and MDMA-assisted therapy through Health Canada's Special Access Program, and we can talk more about that if that's of interest. But the other thing that I'll also say is part of the training that I did at the California Institutes of Integral Studies involved the first aspect of the MAPS training in MDMA assisted therapy for post-traumatic stress disorder, which is a week-long residential training. The one that I went to was with Michael and Annie Mithofer, who were two of the early therapists. And so I completed that training there and got a chance to work at the tail end of the phase 3 clinical trial in Vancouver, looking at MDMA to treat post-traumatic stress disorder. So those were the opportunities that happened there. And then now I'm at a different clinic. Numinous unfortunately closed down their operations in Canada, I think in June 2024. June or July 2024. And over the past year, I've been working at a center here in Vancouver called the Center for Medicine Assisted Therapy, with a couple of colleagues and friends, Dr. Devin Christie, Shoshana Ward, and Louis Retief, and very small, just like 2 treatment room clinic, beautifully curated, really heart-centered kind of lovely space and small team. And there we're also doing ketamine assisted therapy, and so far have offered special access approved MDMA assisted therapy for PTSD. We have at least one application in for psilocybin for treatment resistant depression, but that hasn't been approved yet. It's still sitting with Health Canada.
So, if I can pivot a little bit to, you've had experience with
Mhm.
different medicines and different indications. So you mentioned ketamine, psilocybin, MDMA. I'm not sure if you worked clinically with ayahuasca. Do you have any intuitions on sort of what combination of medicine plus adjunct or ancillary therapy approach for a particular condition, say depression versus anxiety versus addiction or eating disorders? I mean, there's a whole range of different types of needs that people seek psychedelic psychotherapy for. Do you have any sort of early intuitions from your own personal or sort of practical experience in delivering this?
Like, how do I think
Yeah.
about that? Yeah, I do. I will also, in response to that, say that I haven't worked clinically with ayahuasca. And in my practice, I've done quite a lot of preparation and integration work as a therapist for people that are
Right.
attending ayahuasca retreats in different settings. So I offer, I guess, like ancillary support to people that are doing that. And I have a sense of what and how that is, as it's done that way as well. And as we spoke about before, providing, on the ground sort of group processing support as well while people are at retreats. So that is a little different to me, with it being this like group and ceremony process. But I think the first place I go with that question is that for some of these indications where we tend to see people having quite a lot of psychological rigidity in themselves, really patterned ways of thinking and behaving and perceiving that, they may have tried mainstream approaches like CBT in order to address and just haven't kind of made the progress that they would hope to or wanting to or found the kind of relief that they're looking for. Um, there's, I guess, from my view, often some underlying trauma or traumas, and frequently those are developmental. And when I say that, that doesn't just mean sort of like what people would call big T traumas, like I had, some severe incident that happened in childhood or in adulthood. But there's also all these little T traumas, which are about the absence of things that maybe should have happened that didn't, experiences of, emotional neglect, chronically, I think, like in our culture here, like fathers that aren't present or available, things like this.
Early childhood
And
attachment issues. This is definitely something that
yeah,
came up
early,
for me in a recent ibogaine experience that I hadn't sort of explored as much in previous modalities. So definitely can
yeah,
attest to, yeah, therapeutic benefits from acknowledging and then actually addressing some of those small T traumas. But anyhow, sorry, please
yeah.
go on.
Yeah, exactly. So these are the pieces that sort of underlie what are then the symptomatic presentations of the depression or the anxiety or the OCD or the PTSD symptoms. We end up being kind of like stuck at a level of trying to address symptoms without getting to, some of the more causal layers. And so back to, like, what does this work for? It works, I think, sort of across psychedelics. We're seeing this, transdiagnostic piece where, regardless of whether we look at research for ketamine or ayahuasca or psilocybin, we're seeing benefit for some of those same indications that you've said,
Mhm.
anxiety, depression, PTSD. And so at this point, I don't necessarily think that there's one that's best suited for the indication, but more where we get, I think, like more nuanced and specific is what is the correct medicine for this person based on what their presentation is, but also, what their personal history is. Do they have previous experience with substances or altered states of consciousness? Or is this going to be something that's completely new to them? And, are they a person that might benefit more from an individual process or more from a group process? And I think, like the more advanced level of this is getting nuanced about being able to, meet and initially sort of screen and get to know a person and then figure out what's going to be the right medicine for them for the piece or pieces that we're trying to address, because ultimately they're tools. They're not solutions in themselves, which is very different from a Western medicine, allopathic medicine sort of approach where it's like, oh, this type of depression responds best to this psilocybin
This
pill.
is applying the art of clinical practice rather than the sort of hard science of it. Is that sort of what you're saying? Yeah.
Yeah, that is definitely how I see it. And there's like, um,
Well, and can I ask,
yeah.
you've seen, profound transformations in terms of healing. You've also seen
Mm,
partial or mixed results or sometimes difficult
mhm,
activations in clients that you've worked with.
mhm.
Can you speak to the importance of preparation and integration with respect to how to, prepare people for what's possible, but also the potential that things aren't necessarily going to manifest the way that they hope and how to deal with that?
Yeah, yeah. So I think that in my view, at this point, from having the opportunity to do this over the past several years, is that oftentimes what's offered in protocols in terms of preparation and integration support is perhaps adequate at the short end, but not optimal and kind of far from optimal in a way for me. And part of that comes from being informed by research protocols, which, by necessity are needing to create a standardized program and offer that to a number of participants and to evaluate the outcomes of that. And as we've already mentioned, there's costs associated with this that can be quite high. So both for the cost associated as well as, the time the intervention takes, there's good reason to have that be not too long. We don't want someone to be in a research protocol for 6 months or a year,
Mm-hmm.
ideally. And I've landed at a place where, like, the more preparation that we can do, actually, the further we can also get in those medicine experiences and the integration. So there can be such an emphasis on the medicine experience and what that's going to provide. And I think it comes also from this, cultural view that it's like the medicine is going to be what fixes us. Whereas, I'm inviting the perspective that these are tools that serve to support a therapeutic process rather than a fix in and of themselves. I mean, if MDMA on its own cured PTSD, we'd have a bunch of ravers that are really, healthy folks. And,
And 100%,
unfortunately, that's not the
100%
case.
response rates in all the clinical trials, which also is
Right,
not the case.
right. Yeah. And so the preparation phase is important for building relationship, trust, rapport. This person in the medicine experience is going to go into a very deep and open place in themselves, and they need to feel, hopefully, enough trust and safety in the person in space that's going to be holding that, or the people in space that are going to be holding that. We also need to get to kind of like map, this person's world and experience and how they respond to things. So sometimes I get people that have come and they're like, well, I've done lots of therapy before, so I don't think can we kind of skip the preparation and just get right to the medicine? It's like, well, yeah, but we don't know, I don't know you, you don't know me. And in order for me to be most effective as a therapist for you, it's like I need to have understood and mapped some of that, like, terrain and background and, attachment wounding, relational patterning, traumas that have occurred, how those live in your body and psyche now.
And if you had
And so
direct
there's
experience with individual clients, I know I'm not naming anyone, but can you think of examples where
Mhm.
the kind of deeper preparation work that you've done has yielded better results as a consequence?
Yeah, certainly. I have had the chance sometimes where people, a challenge of the special access program is that it takes a while to get approval from Health Canada. And in some cases, then while that approval is being awaited, folks might be willing to just engage in some therapy leading up to that. I've also had a special access client with psilocybin where I really was encouraging. I'm like, I think, we need to do a minimum of like 3 90-minute preparations. I think that's what we were requiring at Numinous at that time. But, if you would be willing to extend that to 6 or 9, I think that that's gonna actually end up being like well worth the extra expenditure for you. And in those cases, I feel my perception is it really has, those people had positive experiences. Obviously, they don't then have the
Yeah.
comparison of like, well, how would it have been? And neither do
Yeah.
I, if they would have done less. But I feel like I can be a lot more effective. Like in just a few sessions, I'm basically teaching a lot because the other part of preparation is I'm needing to provide a bunch of information about, you know, how this works, how I can support you in the medicine session, the various different types of range of effects you might experience, and, how we skillfully navigate those things and support you in that. And, some different concepts that I like to teach along the way. And so in, say, 3 preparation sessions, which is often standard in research, I feel like at least in my experience doing it, like I'm talking half the time because there's all this information I need to share with them. And then it really actually like isn't that much space that I get to really, really know them in a deep way that I feel like is really
So building
beneficial.
out that therapeutic relationship or therapeutic alliance is ultimately what may be paying the most dividends in your estimation,
Yeah, and just knowledge of them
right?
because I can pull those pieces out more skillfully, potentially in the medicine experience if they're already arising and support that, as well as, it just eases the integration because now it's like, okay, what are we trying to, repair or change or do differently? I'm not still trying to figure that out with them once we've gotten to the integration point. Because sometimes a shorter protocol for me ends up feeling actually like, it partially therapeutic and partially
Mm.
diagnostic. Like I get to the end of a shorter protocol with ketamine with some people, and I feel like we've done some good work and we've really clarified the work that's to be done ahead, but it hasn't, encapsulated sort of the completion of what they would have ideally come for in total. And it's a challenge in marketing this stuff right now, right? People want to know, what am I signing up for? And so it seems to make sense, at least in the spaces I've been in, to offer people like a protocolized treatment option because that kind of gives them a sense of like how long this is going to be, what's it going to cost me. And, I guess in some therapy modalities, you might go and be like, okay, this is an 8 session intervention. But a lot of times, like people that approach me in my private practice and the way that I've approached therapy, it's kind of like, okay, we're going to start meeting,
It's more open-ended.
once every week or every 2 weeks for a bit, and we'll
Yeah,
see,
yeah.
right? What kind of needs to
So
happen.
from where you're currently sitting, and you say you're in this sort of smaller boutique type therapeutic clinic setting, what are the biggest
Mm.
challenges that you see for people getting access, the Health Canada Special Access Program? Um, and obviously, clinical trials are often limited or don't always yield the sort of permissions that are needed. How do you see sort of moving forward expanded potential for people to be able to avail themselves of these kinds of treatments?
Yeah. Yeah, like you said, I mean, research opportunities are quite limited, especially, in whatever someone's geographical region is. I'm sure you're getting listeners from all over the place. So, those opportunities are limited. There's a new research, I guess, approach that seems to be emerging here in BC. I'm not sure if it is elsewhere as well, of these sponsor or not sponsor, stakeholder funded studies where some groups have gotten approval from Health Canada for participants to be able to pay to participate in research, which was not, I didn't understand that that was possible previously, but it seems to be something that's happening now. So I guess that's another way that some folks in limited capacity can participate in
Yeah, I
research.
believe one of
Um,
the clinics is here in Victoria, Savvy Mind, working with TheraSil and offering
mhm.
psilocybin experiences for wellness, where it is a clinical trial, but it's also not
Yeah.
sort of following the standard drug sponsor model of payment, but it's allowing individuals seeking that
Yeah.
experience to pay for it themselves.
Have you heard anything about how that's going?
Just that it's launched, it started. I think they've had some
It's
patients
it's
enrolled or
running.
clients, research subjects. I'm not sure how to best describe them. So yeah, definitely an
Yeah.
interesting development, and I believe there's now another that's been approved as well, and hopefully we'll see more like that moving forward because it certainly opens up the potential for both access and clinical research and knowledge development through that model.
Yeah. So I'm very curious to see, what sort of further pathways that might open and what happens there. But in terms of what I'm doing, ketamine is able to be prescribed by a
Sure.
physician for the appropriate indications that that physician feels like it's, warranted. It is an off-label prescription for mental health indications at this point, so they need to be guided by research evidence around that. And then with the special access program, Personally, I feel like this is actually a very challenging avenue for a patient to be able to access this kind of treatment through. The way that it works, I'm not sure if listeners might already be aware of this, but is that an individual physician needs to put in an application to Health Canada on behalf of a specific patient requesting approval for a given medicine for a specific indication. And this isn't specific to
Hmm.
psychedelics. A physician could be requesting access to a cancer medication, for example, that's undergoing research somewhere and showing promise and isn't yet available in Canada. The caveats to that are that the client or patient needs to have undergone at least two existing evidence-based treatment modalities for their condition and failed those.
So it's a pretty high bar
And
to even consider being eligible.
it's a pretty high bar, and it needs to be for an indication where there's a substantive enough body of evidence already existing that this could be a good alternative treatment for them. And so for me, so far, the patients that I've got to see through the special access program have only been MDMA for PTSD and psilocybin for treatment-resistant depression.
Right.
I think there are cases of psilocybin for maybe like end-of-life existential distress, sort of anxiety. I'm not sure if others have gotten generalized anxiety approved. I imagine there could be an argument for smoking cessation or alcohol use disorder at this point with psilocybin, but the ones I've been involved in, MDMA for PTSD and psilocybin for treatment-resistant depression. And so in order to access this, a patient needs to find a physician who's knowledgeable about this process, who's supportive of putting together an application for them, like thinks they're a good candidate for it, is going to go through all the paperwork with them to do that and submit that to Health Canada. In some cases, Health Canada then ends up rejecting it, and then they need to put an appeal in, so there can be quite a bit of paperwork there and an unclear time frame at this point on which Health Canada responds. That physician also then presumably needs to be connected to a therapeutic team, in many cases, a co-therapy team, but one or two therapists that are trained and have experience doing
And can
this
access the medication. Yeah.
and can access the medication so that suppliers are limited, have the storage facility at the clinic to receive and store and dispense a controlled substance. So it's a particular environment which, Devin Christie and Shoshana Ward have set up at the Center for Medicine Assisted Therapy, or, Numinous was resourced to set up, but there's not many places like this at this point. So, patient needs to like find this. They need to be ill enough, basically, to meet the criteria, but as well as being ill enough to meet the criteria, they also have to be like fairly patient because they need to be patient enough to go through the
Yeah. Jump through the
process.
hoops.
And then in some cases, they need to taper off, many cases, they need to taper off existing medications,
Right.
which is also a challenge. SSRIs are contraindicated for both psilocybin and MDMA.
Well,
So,
on a slightly more hopeful note, I guess, even though there are all these barriers, there are access points through that program. And I guess south of the border, developments at the state level in the US that are showing all kinds of innovations that we may ultimately be able to benefit from here in terms of advancing both the sort of clinical practice models and ultimately research evidence. I'm just looking at the
yeah,
time and realizing that we're running up to the end of the hour and are probably going to have
okay,
to wrap it up. Um, but I
okay.
really, any final thoughts you'd like to share?
Well, something that seems kind of absurd to me at this point in that regard is that, so clients are coming expressing interest in this for psilocybin. And, sometimes we're in the position of turning them away, unfortunately. And there's mushroom dispensaries, several of them, open as storefronts in Vancouver. And so, someone can go in and walk into a storefront and avail themselves of, this substance on its own. I've been in some of those places. Some of them sell MDMA and other psychedelics and research chemicals as well. And so people can walk into a storefront and avail themselves of these things. But there's, all these barriers to being able to provide it in, a responsible therapeutic container with people that have the training and experience to do this, to help ensure people's well-being, safety, hopefully optimal therapeutic
So
outcomes.
the irony of our drug laws are that the safer alternative is less available than the more risky one of unsupervised, uncontrolled access and use potentially. Yeah,
Yeah. And a frustrated potential prospective client will say that, be like, fine, I guess I just go out to Granville Street and buy it myself then. And it's
well,
heartbreaking when
hopefully folks
that
can
happens.
learn from conversations like this about ways to potentially seek out supports and do their homework so that they minimize the risk and hopefully maximize the benefits. So Cody, I think we're going to wrap up here. I really appreciate you taking the time to talk with me and to join Intonicated. Do you have a website people can find you?
Yeah. So my personal website for my practice is just www.codycallon.com. Hopefully you can put
Yep.
that in the show notes. And I'm available for individual psychotherapy as well as like harm reduction and integration, counseling. I do some teaching and consulting and supervision as well. So all my details are there. And then I'll also mention the Center for Medicine-Assisted Therapy that I said, involved in, that has ketamine-assisted therapy available, as well as can support people through special access program applications to Health Canada. And the website for that is medicineassistedtherapy.ca.
Okay. Well, thank you again so much and have a good evening.
Yeah, thanks again for having me on. It's been a great conversation.
Okay, bye-bye.
The content in this podcast is for informational and educational purposes only. It is not intended to provide medical advice, diagnose, treat, or prevent any disease. Always consult a qualified healthcare professional before making decisions about your health or the use of any substances discussed here. Psychedelic substances remain illegal in many jurisdictions. Listeners and viewers are responsible for knowing and complying with the laws in their area. The views expressed by guests are their own and do not necessarily reflect those of the hosts or affiliated organizations. If you choose to explore these topics, please do so with caution, respect, and awareness.